Good evening, everyone. This is September 25th, 2019, and I am so grateful to be here tonight. I'm looking forward to everyone joining us and having an opportunity to share a topic that, might give you some things to think about and ways to help some of the people that you interact with and your Facebook people, your friends, your family, and understand how to walk past things that occur in our lives. Thank you, everybody that's coming to join. I'm just excited that you're here. My lungs are still healing. It's been 4 weeks now, so please forgive me for that. So I'm Kaleem Joy. I'm a licensed midwife. I'm a certified pediatric massage therapist, and I'm a certified professional midwife. And I am excited about Natural Childbirth 101 to share with you the many things that I learn as I go through midwifery for over 20 years. And as each one of the families that I serve, I get an opportunity to learn a little bit more about what life is like, including my own life. So let's talk about our topic. And our topic tonight is trauma as it relates to birth, breastfeeding, and life. Those are big worlds to talk about. So we're going to do that in a short amount of time. When you look at trauma is something that actually our bodies and our minds were programmed to pay attention. They are said to pay attention, watch what happened, evaluate, take a memory of this, and put it into that core memory. And for those of you, and this may date this particular video in years to come, there's a animated film that came out a handful of years ago that's called Inside Out, and it's all about our emotions. And I had to really thank the creators of that because there's so much reality in the big memory banks that they show and the different types of memories that we have, as well as our core memories, those things that we really hang on to that make us who we are. There we go. And when you look at all those memories up there, one of the things that occurs is that when those memories are no longer needed, they kind of went over the hill and into this kind of dark gray abyss, and they just poof, went away. And I like to really take that analogy and realize that some of our memories just disappear. We don't remember exactly, something that we ate 20 days ago. That memory is like not needed for our living and our sustaining. And so there are certain things that we don't commit to memory. So our brain and our body says that when there's a trauma, such as, all right, the simple one, you touch something that's hot, you go, ow, your body says, oh, if I touch that, it's hot, it hurts, and my neural system remembers that. So it begins a learning process that says, don't touch that, it's hot, right? We've all had that one. We have all trained our children to understand it. The same way as we have things that occur in life, or we hear about things that happen to people, such as somebody who gets into a car accident. They think very carefully, how did I get into it? Was I doing this? Was I doing that? Was I not paying attention? Was it, the way the lights were? Was the sun in my eyes? And when you go past that street, when there might have been an accident, you remember it. Because your body and your mind and your innateness doesn't want you to get hurt again, and it's there to help you survive, right? So let's take that further in life. And when there is something that occurs that is traumatic enough, we also, whatever it is, even a car accident, somebody passes away, there's an event of something like, you hurt your finger, you break an arm, anything like that, or even news, traumatic news. We often can say, I know where I was, I know what was going on, I know what I was wearing, and all these memories set in with trauma. because our body and our mind and our spirit wants us to make sure that we don't entertain that again if that was something that is not good for us. So let's take it into some other things in life, such as into birth. Now, going through birth, there can be issues that can come up. And for some birth givers and some women, they may have gone through a birth situation, a story, an experience that to them feels like trauma. Maybe it was they had to be induced early because someone was worried about their baby. Their baby wasn't growing, or their baby's water went down, or they were past due and they were worried about it and they had to go through an induction. And so the induction began this process of going through all the technology and sometimes disappointments that things weren't going as fast, and more technology comes in and more things begin to happen until eventually there's that cascade of events that perhaps it ends up in a cesarean section. And the traumas that sometimes go on, say they had to push, and they were pushing and pushing and pushing and pushing, and they were pushing for 3 hours and 6 hours or 8 hours, and the baby didn't come out, and then they needed to go for a cesarean. Another scenario is the baby's heart rate didn't look good, so it was like, oh my gosh, we need to rush you in and do a cesarean, which is totally fine if a baby's not doing well, but the trauma that it set into everybody is there. And is my baby going to be okay? I'm rushed into an OR. Everybody's circling around me. So you can feel that adrenaline starting to pump in you even as I talk about it. And so when trauma occurs, no matter what level it was for that person, it is something that inputs into them as that memory. And they also can get stuck where that trauma occurred. And the reason being is that our brain also wants to say, we need to figure out how this happened and why it happened so that we don't do it again. And so we get caught, our beingness, if you will, can get caught in that time and place, even though we continue on, we eat, we sleep, we do all the things that we do, but that time and place can be something that we get stuck in. And what we hear from many birth givers is they need to replay this traumatic story over and over and over again, constantly reviewing it. And the reason that occurs is that they are stuck in that memory, but it's also because their brain is trying to figure out what happened and how do I not do it again, and somebody validate that was big. Now let's go to the baby. The baby in a traumatic birth experience, whatever that may be, rather the mother is feeling trauma at all, the baby has their own story. And maybe the baby was vacuumed out, or maybe the baby had lots of pushing, or maybe the baby was cocked sideways and the baby had struggles with that. And maybe when the baby came out, there was lots of suctioning, or there was challenges because they had to go to the NICU and they had blood tests and they had monitors and they were separated. Whatever it is for the baby gets kind of stuck in that too. And the baby says, I don't know what to do with that, so let me tell you about my story, which may be that they cry a lot, that they arch their backs, that they have difficulty with nursing. They go through their own patterning of saying, I need somebody to validate that was hard for me and help me know that it's okay to go forward. So whether we're an adult or whether we're a baby, we're looking for that validation that says, I hear you. That was huge. And you did amazing through that, but you're here now. And this is a term that's used neurologically that midwives are taught from years before, but it's a psychological mechanism that says, but you're here now. In other words, you had the circumstances that happened, but you are here now, in the present time, and you are no longer in that trauma. Now, if that's all it would take, that would be easy. But it takes a recognition of what occurred and an ability to go through it and figure out if there are things that could be changed if you went through something like that again that you would do differently. And of course, as a home birth midwife, I hear a lot of this because we often will have families come in and they have had challenging experiences with a pregnancy and a birth and a baby, and maybe that was their first, and then they're coming for their second, and everything in them only knows what the first story was. And so we have to be able to validate what happened in the first story. Be able to say, let's look at each of those pieces and see what could be done differently. And sometimes nothing can be done differently. Sometimes that was the story that needed to be told for that baby, for whatever those circumstances are. If there are different pieces that could have been told in that story, it's helping the birth giver be able to put words to, if you don't want this, what do you want? And it's like that in anything in life. If you don't want this, if you keep playing the don't wants, it's like telling a child, don't step in the puddle. They're going to step in the puddle. Because something within us and within the universe or within our belief systems is they don't hear don't and no. They only hear what we want. And so going through releasing that trauma is one, you have to validate what happened. Being able to give it a voice. And then help it to understand that it is being heard and understood, and you want to be able to come to a way that should you walk birth again, what you want to do differently. A baby has to be heard. And many people who do a lot of research on perinatal psychology and on psychology of newborns after birth, they talk about this, the breast crawl, which many of us are familiar with. Baby goes up or from the bottom and crawls themselves down to breast. Well, this is a reset mechanism for babies who are having nursing challenges, but this is a reflexive neurological programming. And so we often, if babies have had challenges, when they do this story, they cry and they talk and they aren't there and they cry and they're talking because they have to tell the story before they can go down and be in that nursing position that says, I am here now, I am safe, and I can connect. I'm not in that trauma anymore, whatever it may be. Now, that's one way that we've learned how babies tell their stories. Babies tell their stories in all different ways. So how do we help a birth giver to be able to progress? We look at what's there, we validate, and then we look for what would you do different if the situation came up again. In the same way that if something else happened, you know, I cut my finger once, and from that day when I was a young teenager, I am very consciously aware when I use a knife. I'm very present with it because it was a memory of somehow getting hurt. So when I'm cutting with a knife, I'm very present with that knife. And when knives are on the counter, the knives have to be back away because I realize that I have to have a healthy respect for knives because they can hurt. So whatever that is, that you've had something in your life like that, it is there to help us, teach us what would we do in the future to not go through the trauma again. Now, I want to take it a little step further in birth with the birth giver, because sometimes I've had birth givers who, because their labor went on, they had so much trauma, there was a lot of pushing, and they ended up with a cesarean. They said, I don't want to go through that again, right? Because that's the assumption in the body that if we birth again, this is the story we are going to have to live again, because it's the only story we know to put our mind to know what birth is whatever that story was. And they will purposefully opt for a planned cesarean because of what happened in the original story. No one knows what that story would have been like had they gone through labor and allowed themselves to birth. We don't know. But the fear of going through the trauma and what it taught them was, don't do that again. So let's expand on that even a little further. When it comes to getting ready to give birth, whether it's a first, a third, a 10th, doesn't matter what number, we hear a lot, either from past births that we've gone through, they talk to us, or the other people in our lives who have given birth, that they may have had trauma, or they've had great births, or they have a story to tell about someone else in their family and what happened, or social media, right? And the newspaper and the news clips and the TV shows, right? And movies. And so we have that whole input that we then start to formulate what our story is going to be. So I want to encourage you to understand that each baby has their own story. And you can learn from your other births. If they are what you want, you learn what you want. If they are not what you had wanted, taking a look at why. And some situations are really, really specific to the baby and its story. Has nothing to do with any other baby that you may have. And being able to give each one that isolated story is really important for the baby that would be the subsequent baby, to put them through whatever it is just because the one before them had that story, is give each baby their own story. Now, working through some of those traumas that some women may have had, and maybe it's a 4th degree tear, right? That they had such a bad tear from everything like that, that they never want to do that again. And we hear you. We hear that you don't want to go through that again. But let's look at what things can be done to prepare, or ways that the birth can go, and how things can progress to be able to put a different frame of reference to a new story. And the baby has to have that same thing, because babies who have had trauma in their beginnings, they need validated and they need permission to release it. They can release it by you doing lovely massage on them, by getting someone who can do cranial sacral. Cranial sacral helps to release those patterns from the past. From being able, and I've done this with numerous children and taught parents, when your child's asleep, you can hold them or kneel next to their bed and talk to them from your heart and tell them that you're here to listen. And when you listen, you gain so much insight that their little spirits seem to talk to your heart, and you're able to give them reassurance of what you can to help them through that process. But our bodies have memory. Our neurosystem has memory. Our muscles have memory. And I want to take it to an example. If you were standing up, all right, imagine that you could stand up and you could point your finger straight ahead. And if you look straight ahead and then turn your body around as far as you can go, as far around as you can go, and see where that point is, and remember that point, and then come back and close your eyes and envision a point that is further than where your finger went, right? If you can only go this far, that you envision it, that it can go way back further. And you envision it, and then you open your eyes and you go. You will be so surprised at the fact that you can get around further than you thought you could. And why this occurs is it's how our nervous system is programming. It's reprogramming all the time. And that's why you can have confidence that if you'll walk through that journey and look at the places that were causing the trauma, whatever it's from, and say, I hear you. Let's look at it from a different point of view so that we can see how we can walk forward safely. And you don't change how the original event happened. What you do is you change how your reaction is and how you plan to handle it in the future. And when you do this, it's a muscle motor memory. Athletes use this all the time, and it works, okay? So when you look at being able to get past trauma and helping your baby to get past trauma, validation and then looking to how to walk the road differently is so helpful. All right, let's talk about breastfeeding. So breastfeeding can also show up and it can leave trauma. We know that if a baby's tongue-tied, their jaw is too tight, they've got too much muscle tension, the nipple is inverted and the baby has other issues. Maybe it's a large nipple, a small baby. Maybe it's a milk supply issue, but there's trauma to the breast physically. Maybe the nipples have gotten injured. Maybe they're bleeding and there's pieces and the baby's struggling because it can't get the milk and the baby feels the stress and mom's trying to pump to bring up milk and she's got herbs going in and she's trying to bottle feed. I mean, here's a whole nother story that some birth givers, some mothers have to endure, and they persevere through to find what is going to work best for them and their baby. And when that happens, some of them may not continue breastfeeding. And when that occurs and the next baby shows up, there's a hope. That's what we all hope. There's a hope that says, I'm hoping that if I set certain things in motion, that we won't have to go through what I went through with the other baby with this baby. Remember, every baby has their own story. Learn from it, but don't predispose the next birth or baby to what happened with the prior one, but learn from it. So when that baby comes along, you have an opportunity to begin doing something different. Now, if a birth giver, a mother has stopped breastfeeding because of all of these things, because they take away that opportunity to really interact with your baby and your newborn stage, and you're exhausted and etc. And sometimes there is that window that says, is it time to enjoy the baby, stop trying to nurse, pump the milk, or bottle feed and use formula? That's the question at that time. And the thing is that when the next baby comes along, sometimes some mothers and birth givers say, I'm not going to breastfeed. I don't want to go through that again. And it's the same story as not wanting to go through birth again, because it's the only story you know. You don't know any other stories. If the first baby's like that, but your second, third, fourth, fifth, however many you choose to have, is not like that, then that has to be given an opportunity to work with. Okay, let's see. Comment. If a child neglects one breast altogether, is there a high chance they'll happen again with the next baby? So, is it a high chance? Good question. In my experience, if that breast tends to be a low producer, many babies will gravitate eventually to the high producer, and that side sometimes doesn't get the stimulation and the milk dries up. From a body worker side, I have a question mark on that says some babies hurt when they're on one side, which means it's harder to milk, which means the milk doesn't keep getting extracted out, which means the baby gets put on the side that makes milk, which means, is it the baby that's causing the lessness, the reduction in supply that is causing the baby not to like that side because it's too hard to get milk? Or is it the breast that's struggling with that? What is the story with that? And so, can I say it's likely to happen with the next? Nobody knows. If it happens with each baby, then it's probably isolated to how the breast gives milk. Women can breastfeed from one side. The milk will be made as long as they can make milk. It does well. So, hard to say. But I always feel like don't predispose that that will happen, even though your memory to some extent wants to go, my other baby, didn't like that side. Give them a chance. Give them a chance to really show you what that side can do and not predispose. Those of you who have more than one child, you do realize very quickly that your children are not alike. They may have similarities because they're raised in a family, but they are not the same individuals. Therefore, we need to give them an opportunity to have their own story, right? All right, so breastfeeding. Give it a chance, but set yourself up with helpful people, making sure that somebody assesses maybe why it happened and see if that can be worked through. Maybe with that side, maybe the next baby is a little shy on it too, so you pump that side a little bit and see if it can keep up milk. Maybe that's all the baby will need in the beginning to get it loving both sides. I have often had a first-time baby who didn't care for one side real well. The next baby, it was the opposite side. And mom said, go figure. And I'm like, yep, it's separate babies and you have to give them a chance. Case in point, there's a lovely family, and I've had several families. We have families in our immediate family and families that are in our practice and that their first baby was a great struggle. They ended up being pumping milk for the baby for a year and bottle feeding. The next baby, that baby nursed, but the milk supply wasn't as good. The next baby, it was better. The next baby was great. The milk was there. And so sometimes it improves as babies go along as well. Okay. All right. So not predisposing and not assuming that if you didn't have enough milk with one baby, that's going to be the case with the other, or vice versa, that you have a oversupply with one baby that the next baby has to deal with. Because so much of this is learning about the babies. Because sometimes if their motor development that's going on here is not able to comfortably extract, we think it's an oversupply when it's really that they're trying to mechanically handle it, right? Sometimes it is an oversupply, so it's there. All right, let's see. What do I do with my glasses? There we go. I have to remember. I'll make sure I make time. Wonderful. I'm so glad, Cindy. Please do. I appreciate you being here. Thank you so much for joining me tonight. All right. Life in general. As I mentioned, we've got things that happened in life and we can get stuck there. So I'll tell you a personal story for me, and a personal story is one of my grandchildren at 5 months passed away. So the day that all occurred and everything that went on for me was a trauma, right? And so walking through that, instead of it controlling me for life and living in that, I had to decide how was I going to fit that into my life and where was it going to reside. So whatever that challenge is, because sometimes it's miscarriages, one after the other, or a baby that was maybe, above 12 weeks and there was a miscarriage and your heart says, why? How did it happen? How do I heal from this? And that's, again, giving a voice to that wonderful birth giver and woman who said, that made me really sad and I didn't want to go through it, and here's how it happened, and I need to be able to validate that story and be able to put love and honoring to that baby and give it a place in my life and be able to move forward into what the story is. Because we sometimes feel like that means I'm going to forget them. You will never forget them. Your brain will not let you forget them or forget whatever those traumas were. But it's a matter of finding a way to make peace with them. And when you can make peace with it, that's when it can live in a place that, should you ever decide you want to pick it back up and go through it all and feel it all again, you can. But you also can say, I am okay to have peace about this and know that it no longer has to keep me in the past. that I can go forward into the future and I can have new experiences to help shape my life and my children's. Now, there were a few things that came through that ran up. Let's see what people had to say here. Oh, never be sorry to ask questions, by the way. Tell me what your... let's see. Any tips on interviewing midwives? Yes. Okay. Interviewing midwives. One, you want to be able to connect personality-wise if you're having a home birth. In a hospital birth, that is really helpful if you have a few midwives that you can connect with. It depends on whether they take calls, so you have to be able to be adjusted of who might be there at your birth. But let's say that you're going to be with a practice that you have an opportunity to choose who those midwives are, is go in and be able to write down, 10 or so questions that are most important to you. And some of that may be, how do you handle, if I am struggling in labor, or how do you handle dealing with high blood pressure, or how do you handle transfers, or whatever it might be that is most important to you. And online there are so many things, so many lists that you can copy off. And I know for myself, I'm able to go through an entire consult because I've done it so many times, and almost all the questions are always answered because I know what those questions are going to be. Is it safe? How much does it cost? And what options do I have with midwifery care that's licensed midwifery care in a home birth? For those, if you, Anna, if you want to see what a consult is like and you weren't with me with my live, go to my Facebook page, Natural Childbirth 101, and look up a midwife consult, and you'll get a whole midwife consult of what goes on. And that may give you some ideas of not only what we do, but also what questions you may want to ask. And sometimes it may be all about breastfeeding. Tell me how much you can help me with breastfeeding, and here was my story, and what things might I do different? Or I had a hospital birth last time and I pushed for 3 hours. How would that be handled at home? Or what could I do differently? Or what are some of the things, because I had a tear that was bad, what might you do that would be different than what would be done by, an OB or a hospital? And then the other part of it is connecting with them as a person. You want somebody there that you feel good about, that you feel that they can listen to you, validate you, educate you, and also hold space for safety and helping you to have the best experience that you're creating, right? Because it's about that ownership. Remember that. All right, let's see. When do you suggest starting with a pump? I was told to... I was told to not use it too soon for risk of oversupply. So if you have a side that's struggling with milk, I would start that pump by somewhere between 5 and 8 days, and you might do it for 5 minutes every other feeding on that side, and see if you could just lightly stimulate enough milk to help there. If you recognize that that side is not as full, you can do 10 minutes every couple hours if you want to for a couple days, and maybe then you don't need so much. If you're watching the supply come up, if it just needed a boost, if that's a side that sort of needs more encouragement and more talking to it, then go ahead and talk to it, right? I always say you can bring down supply, but it's a lot harder to bring a supply up. And the first week is an important time to establish that supply because of the prolactin that spikes and because of laying down all the receptors for that prolactin for the future. All right, let's see. So when we go back to looking at trauma and healing up from trauma, you're welcome. I want to just encourage you that journaling is a great way to go ahead and say, I'm going to walk this. I'm going to write down everything that happened, how I felt about it, and look at the things that I can then go back and see as where could something be done differently. And if you don't know what the different thing can be, but you just know something needed to be done differently, then find someone. You know, I've had women come to me who have had cesareans and said, will you look at my records? Will you talk with me about what happened and help me to understand what occurred from what you can hypothesize from everything that she tells me, as well as what the notes tell me and what I understand about birth, and be able to see if I can't give that birth giver a picture to work with and understand what might help. And that's regardless whether they do home birth or hospital birth, whatever it is. Because remember, birth is birth no matter where you are, right? So I think that being able to have somebody to talk with that, there are different therapists that are out there that work with perinatal trauma healing, seeing a body worker, getting cranial sacral, having Watsu, and if you don't know what Watsu is, WATSU, please look it up, it's really amazing. But getting these things to help you work through that before you have the next baby. Because the one thing is, we don't want the past birth being in the next birth. And I work a lot with women throughout the years that have had cesarean births and have had difficult labors to help prepare for the VBAC that's coming up, right? And there's a live that I did on VBAC, so if any of you need to go back and look at that, go back to the Facebook page where they're all saved. And looking at how do you go forward in a new story and not take the old story with you. And I learned this many, many years ago when I taught for Kaiser many years ago, and I taught their VBAC class. And that was one of the things, was coming up to what is the story that you have from birth and how would you like to tell it differently for the next book. All right, let's see what Danielle has to say. I use the guided meditation app called Expectful. All right, listen to that, everybody. Expectful. They have specific tracks for trying to conceive, each stage of pregnancy and postpartum. It helped me sort out my feelings and connect with my babies. That's awesome, Danielle. Thank you for sharing that. There are so many tools available to you. The apps, yeah, I mean, there's so many things like that out there. So Expectful, that has been done to help you work with those types of things. Whether you have a one-on-one or you have something that is something you can listen to or use at home. Journaling, I find, helps a lot. If you're an artist, draw it out. Draw it out and let it have some voice to it all. Art's very powerful in being able to do that. So being mindful means that you come into present time moment. And if you feel like you're running a hamster wheel of telling a story that was traumatic, say to yourself, wow, that hamster wheel keeps going around and around and around. That must mean that I'm still on it. And I need to stop the hamster wheel, climb off, and figure out what happened. And when you do, that's where the healing really starts to take place, and where the future pregnancies, breastfeeding, whatever, is able to have a clearer path to a much better outcome, right? So feed me more of your questions or more of your thoughts. I love it. Do midwives have nitrous oxide as a pain control option? So nitrous oxide is kind of making its way back into the birth scene. It was kind of there back in the early, I don't know, probably 50s or thereabouts, 50s to 60s. It kind of went out. The epidural took its place, and now nitrous is coming back again. In a home birth setting, the equipment at this point in time, hey Jessica, the equipment at this time is not available to be able to take it to at home. It would be too big, too difficult. And And I guess some of it is also looking at the philosophy of being at home. Now, the birth centers, the freestanding birth centers, are including nitrous. So that's an option. Now, what I've looked at is birth works. Birth works by those wonderful chemicals working good, using water, using showers, using massage, using encouragement, using quiet, being in your own home, etc. That works. There are sometimes an anxiety that could surface in some birth givers that may make it more challenging for them to deal with birth. Now, one of the examples is the MTHFR gene. We have noticed that their reaction to sensations during labor are heightened. And so they feel more of it because they don't create the same chemicals that help to deal with it in the same way. And anxiety can be a little higher, which can precipitate that adrenaline. And so nitrous, for those that have that expression to that gene, to that level, not everybody expresses it to that level, but that expresses it to that level, nitrous is an anti-anxiety drug. And so using it is bringing that anxiety down, which may be the way for someone versus having an epidural and a high interventive birth, to have a birth in a birth center and have a really positive vaginal birth in a low techno place, such as a freestanding birth center. So no, we do not carry nitrous at home. We did have an anesthesiologist one time ask us if we gave epidurals at home, and we said no. One, that's not within our scope of practice, and two, it's not within our philosophy in a home setting, and there's too many possibilities of complications, which is why it wouldn't be warranted to do outside of a hospital setting. All right, how do you know if you have that expression to that gene? So you can be tested for it. They suggest that about 40% of people have it, and it's called the mother gene, or the MTHFR. And it does mean that folic acid is something that builds up in you, and you need folate, methylfolate, because your body doesn't methylate quite as easily. But you can be tested for it. Just know that if the gene is there, that the mutation is there, everybody expresses it differently. And so just because it might be diagnosed doesn't mean that X, Y, and Z is exactly in a box. And we've definitely noticed that. Okay, but it can affect how you feel labor. It can affect how you feel life. It can affect breastfeeding, because sometimes if that discomfort threshold is really high, nursing and nipple discomfort and things of that nature can be really heightened. So nursing can feel really uncomfortable for some. But that's taking that expression to quite the outside limits. And so, but you can be tested. It's a blood test. You can even do the 23andMe, or, you know, there's several of those. Find out what your genealogy is, that can also tell you this test. It's not as specific, but you can be tested for it. It's just a blood test. All right, more questions. Let's see how we're doing here. Good. I want to touch on your partners and trauma for them. When it comes to birth and breastfeeding, and even during pregnancy, miscarriages and things of that nature, your partners have their own story, their own experience that they go through. One, for their own emotions, and two, what they have seen you go through. And so birth by its nature, for some partners, can feel like it was an overwhelming experience that was incredible if it was a birth that had a lot of interventions or a lot of pushing or things of that nature. And sometimes they can share with you some of their anxieties that in so doing that, you're like, but that's not what was going on with me. Case in point, many times partners or other family members will say to a birth giver, what do you mean you're going to give birth at home? There's no drugs or anything like that. You were in so much pain last time. And they go, I wasn't in pain with my last birth. It was just strong and powerful, or I was mad at what was going on, but it wasn't pain. And it is the perception of the people outside of you of what was going on, not your perception. Case in point, also, we have to help partners understand that if there has been a lot of trauma in the birth, such as the baby ended up with resuscitations or NICU, or you ended up with an urgent cesarean, and your partner's getting dressed and they're worried about you and they're worried about the baby and they're watching everybody go around, they're watching this from an outside stance, and for them, they have their own trauma. They have to be validated for it, but also to not say, well, I don't want you to go through that again, so don't do that. So it comes to the same story as the birth giver. You have to be able to say, I hear you, I understand what you're saying, and we need to find a way to move past that for this next birth, because this birth is not the last birth. So have compassion over them. If you're looking for, I want to have this natural birth, I had a cesarean last time, I want to have a doula or a midwife, and your partner's going, no way, that was too scary. You need an obstetrician and another cesarean because I'm not going to go through that again. So understand that they also have their own story, whether it's partners or family, and etc. All right, I've got some questions that came in. Let me go back and find them all. Let's see. There we go. I'm so grateful for all of you that have joined me tonight. What a treat. Do most midwives have... Okay, I got that one. So many good ones. I miscarried at the beginning of the summer and am now trying to conceive again. Would you recommend taking methylfolate? 100%. Methylfolate is important for cell division, and it is okay if you are not the MTHFR to take methylfolate, but if in the remote chance that happens to be a gene that happens to be expressed in your body, you want to make sure you have good folate so that you have good cell division when that egg divides from where it is in the ovary, so that you get clean division of the right chromosomes, and so that your body is stored up with good cell division methylfolate, so that as the baby is subdividing and forming all of its lovely little organs, especially their palate, their lips, their heart, their tummies, because we see a lot of midline issues nowadays, and miscarriages sometimes are because something did not go right as things were getting formulated, and so the body is smart enough to say, let's start over. So taking methylfolate is always a recommendation going into pregnancy, or as soon as you know you're pregnant, all the way through. And the recommended is about 800 micrograms to 1,000 micrograms a day. Check your prenatals, see if it says methylfolate, and add to that based on what you need to do. All right, let's see. If nursing hurts, is it because the infant isn't latching correctly? If there's a little tenderness in that first week to 2 weeks, where when the baby first latches, there's some tenderness there, that is often still a sign of normalness. But if there's pinching, if there's any blanching, if there's a line on it, if there's scabbing, if it hurts the whole nursing past that 10 or 15 second sort of initial latch on, if it feels like it's pulling instead of milking, something's wrong with the latch. And it may be just technique. It may be the baby has to be moved this way or this way. It may be just technique, but it could be a tongue tie, a lip tie. It can be muscle tension in the jaw, neck, or shoulders, back in the baby. There can be a variety of issues why that nursing is uncomfortable. And I always say tenderness is normal, but injury is not normal. And it shouldn't continue to keep hurting the entire nursing. Because if you take the baby off, let's say the baby's been on for 30 seconds to a minute and you're like, it's still hurting, and you take the baby off, that nipple should be round. If you flip your breast back and look at the nipple, it should be round. If it is misshapen, then there needs to be a question mark as to what's going on with the baby. And some babies will latch great in the first day, and then sometimes there are some things that sort of set in, I like to say like a sprain, if you will, that kind of tightens everything up, and all of a sudden the second day and the third day things start getting harder and something's not working and the baby's going, it can't open its mouth, and you're like, something's going on, because we can't seem to get our latch figured out. Baby's not opening wide and going on the breast. It's kind of slurping it in and trying to hold on to it and biting it. Okay. Always get somebody to come and look at it, or go and see somebody to look at it. Okay. Let's see. And if so, what brands, companies would you recommend? The methylfolate, I like something that's from a Whole Foods, not from the drugstore. I don't find that many things in the drugstore really have a good quality, so go to your health food. I like Source Naturals. I like Nature's Plus. I like Rainbow Light. But there's so many brands out there, even the 365 at Whole Foods. So that particular element is not as, let's say, sensitive as perhaps some other elements would be. All right, thank you. You have them. Oh, you're so sweet, Anna. Thank you. All right, let's let all of you guys in here. Let's see. Both my babies had tongue and lip ties. Could there be any other midline issues that we should check for? So we know that sometimes if they have a tongue and lip tie, there's a palate that's going to be along with it. If the person that diagnose the tongue and the lip tie, they usually will look at the palate. The palate often, because the tongue arches in the back, will be pushing the palate up during the growth. And so once the tongue tie is gone, you need to be able to stroke the tongue down, stroke the tongue down, stroke the tongue down, and get the baby to suck on it. It's kind of suck training, but it's also being able to go up and just gently massage that palate, 4 to 5 times a day, so that the palate begins to drop in early infancy, meaning as quickly, after birth, after the tongue has been handled that you can, to just encourage that to drop down where it needs to be now that the tongue is not arching as much and is starting to come down out of that tethering that was there. Hopefully that makes sense to you. There's great YouTube videos of how to massage babies' faces, inside, outside, doing these strokes and things like that, that you can go and look for out there. But it really does help to get some body work for these babies, because their tongue and their lip ties are not just isolated to here. They are all integrated into these muscles that actually the fascia in the body that connects with the tongue, that fascia is one full, complete fascia that goes all the way down to their toes. So getting that working through. Massage your baby, get those shoulders, move their little backs open, right? And get them, their shoulders, their arms, up into their necks and up into the front, getting some of these muscles up here. And there are other body workers that do this type of work for post tongue tie revisions on these babies. So seek them out. I mean, I do that, but not everybody lives local. All right. How do you treat a GBS infection early on in pregnancy? All right. We have found in our midwifery community that Femdophilus, F-E-M Dophilus, you can get it at any of the health food stores and certainly online. Femdophilus has a particular strain in it that seems to be the strain that helps keep that GBS away. The other is, I love kefir, and if you can make it homemade, all the better. It has good bacteria in it. Your yogurts and things of that nature. But the Femdophilus seems to be one of the best things on that level. As you get closer to term, you can do some rinses with hydrogen peroxide and water that will usually subside that GBS if you stop them. If there is GBS that colonizes in your body, it's going to come back. So if you want to know if it's there, don't do those till after they test you. And if there's no GBS there, you can do it if you want to, or not do it if you don't want to. And then we use a protocol of echinacea, golden seal, cranberry, probiotics, the last 4 weeks of pregnancy. And they take it 4 times a day. And they do a rinse, a vaginal rinse of 50-50 hydrogen peroxide and water with just like a little medicine syringe in the morning and at night. And that's our prophylactic or our preventative measures of saying, if they do test positive for GBS, that this is our best tool for keeping things working better and not having it show up in the birth or for the baby. And then we have them finish that out for about 4 weeks afterwards. Not the rinsing, you don't have to do the rinsing, but to keep the herbs and the probiotics going in. And frankly, it just boosts your immune system, keeps you from mastitis or lowers that risk, keeps the baby healthy, and everybody does pretty good. All right, let's see. Yes, it does. Thank you. We are now trying to do revisions with myofunctional therapy as well, because we are initially misguided on what to do. Yeah, it's phenomenal. It's phenomenal how much those little issues control so much in their body, and the arching that they can do, the pushing their necks out, trying to nurse. When you lay them on their back, they're always fussing and they don't want to be down, and they're dancing around and their bodies are dancing while you're nursing. And all of that is from pain and discomfort, including that they have learned by being so smart, because they knew they had to get milk from the breast, to compensate in their body for what their tongue and their lip weren't able to do. And so we have to understand that they were very smart, and we have to give them a chance to unlearn, depending on how old they are, unlearn that behavior and begin learning that things do work now that that tether's gone, and things can now begin to function like they need to. And for me, I'm looking for babies where if they can't lay on their side and they're always shifting and they're turning and turning, it's like they're uncomfortable. So when they go to breast for that side, they're usually doing this dance too, and pulling back and moving, and they dance a lot while they're nursing. I call it dancing, but they're fidgeting, and that's them trying to compensate for something that doesn't feel good. All right. Yes, it does. Thank you. We are now trying to do revisions. Oh, you already told me that. Yay. Good job. All right. Well, so I am so grateful that all of you joined me. I know that there are several of you that joined me tonight that are brand new. These lives are on Instagram for 24 hours. And then if you go to my Facebook page at Natural Childbirth 101, all of those videos are there that you can go back and watch them. And there's everything from VBACs to difficult breastfeeding to large babies, small babies, midwife consultations, VBACs, you name it. I've been doing these almost once a week for the past year. So our time is about out, and I want to say thank you so much for everybody, for all your questions. I absolutely love them, and for being here tonight. And take what you've learned, and if you didn't join us in the beginning, go back and watch about the trauma and what we get stuck in and how to move past it. And my lovely closing line to you, as we always do, is go in. You guys know all this. You should say it with me. Go in, hug your children. Tell them you love them. Tell them they're amazing and that they can do anything they set their minds to. May you have an amazing week that's filled with joy, with happiness, and good health. Bye for now. See you next Wednesday.